Thank you for joining us today. My name is Dan Hartledge, and I serve as president of Louisville Forum. We typically meet on the second Wednesday of every month at Vincenzo's Restaurant in downtown Louisville. Today, because of health concerns related to the COVID-19 pandemic, the July meeting of the Louisville Forum is virtual. The meeting is occurring on Zoom, as well as being live streamed on our Louisville Forum Facebook page. And the Louisville Forum is a nonpartisan public issues group. We were founded in 1984. The forum hosts debates and discussions of contemporary and sometimes controversial public policy issues that affect the greater Louisville community. Although we may from time to time take up issues that have a national interest, we try to highlight those issues with a local perspective. For more information on the Louisville Forum, on our programs, or to make a reservation for a future program, please visit our website at louisvilleforum.org. Our topic today is the COVID-19 pandemic, assessing Louisville's health. Through yesterday, there were 3,186 confirmed COVID-19 cases in Louisville, with 169 Louisville deaths. Statewide, those numbers, 11,721 cases and 477 deaths. Since March, as the number of cases and deaths have been reported daily, and as we listen to health experts and our leaders voice their concerns, it's been a very scary time for a lot of us. Concerns about the apparent ease in which we can contract the virus, as well as the ease in transmitting it to others. The fear associated with a lot of unknowns, such as how it appears to affect different people in different ways. And the real fear of losing a loved one or our own life. And in Louisville, like every city, there has been a fear of area hospitals and hospital workers being overwhelmed by a surge of COVID-19 patients. For the moment, the number of cases in Louisville and Kentucky appear to be at a plateau, perhaps something of a downward trend, but a lot of questions remain. As restaurants and salons and shopping centers begin to open, what do our healthcare leaders want us to know? Should we expect a spike as restrictions are reduced? Are we ready for a spike? As thousands of residents have gathered at public demonstrations to voice their concerns related to the death of Breonna Taylor, with not a lot of social distancing going on, is a surge imminent? What about schools this fall? Fall sporting events, the Kentucky Derby? And to be fair, some are asking whether we might have overreacted. We shut down the economy, they say, and we built a field hospital at the Kentucky Exposition Center with a 2,000 bed capacity, and to this point, it's not been used. So today we have a panel of professionals who can help answer these and a host of other questions. Our panelists are Dr. Sarah Moyer, Chief Health Strategist for the City of Louisville, Dr. Stephen Hester, Division President and Chief Medical Officer for Norton Healthcare, and Amy Hess, the Chief of Public Services for the City of Louisville. We're going to hear first from Dr. Moyer. A little background on Dr. Moyer. As the Chief Health Strategist for the City of Louisville, Dr. Moyer leads a team of 220 employees at the Louisville Metro Department of Public Health and Wellness, the city's independent academic health department. Its mission is to achieve health equity and protect and improve the health and well-being of all Louisville residents. Dr. Moyer joined the health department in 2015, and since becoming director, she has been a part of literally every important public health conversation Louisville has had. And for the last several months, she has guided the city's health response to the COVID-19 pandemic. Dr. Moyer earned a Doctor of Medicine from the Temple University School of Medicine in Philadelphia. She completed her family medicine residency at the Wake Forest School of Medicine and earned a master's in public health with honors from Dartmouth. She earned her undergraduate degree from Colorado College. Dr. Moyer, I now turn it over to you. The floor is yours.
Well, thank you, and thank you for the invite to be here along with Dr. Hester and Chief Hess. Both of them and their organizations were a huge part of the response and our ability to get ahead of the game with COVID-19. So just really honored to be here to kind of share my perspective and then to answer questions with them. So as you mentioned, I'm family physician trained, public health trained, and I guess most importantly, I am mom to 4 wonderful little children, 6 and under, and wife to the other Dr. Moyer, who's a non-operative pediatric orthopedics with Norton. As you mentioned, I direct a team of about 250 incredible public health professionals that work hard every day to make sure Louisville is a city where everyone and every community thrives. And lately, we've been really, really busy with dealing with a global pandemic. So today, just wanted to share some updates and insights into our response. First, just thank you to everyone who endured the painful stay-at-home restrictions. It really made a difference. It helped us stop the aggressive spread early, which gave our hospitals and our health systems time to prepare, gave us time to obtain PPE, the personal protective equipment, and time to gain more testing capacity. All things that we did not have with this being a novel virus that affected the entire country, the entire world all at once. So today, our numbers, just with Louisville, with our local data, we are showing 2,965 confirmed cases, 180 deaths, and at least 1,932 people that are in recovery. We've tested over 32,000 people in Louisville, and our hospital trends, ICU trends, as you mentioned, have plateaued, did not see that surge that we were expecting early in March. So our cases are really affecting people of color, particularly African Americans and our Hispanic residents, are bearing a disproportionate burden of disease and deaths from COVID-19 here in Louisville and across the country. And that's because people of color are on the front lines as our essential workers, making sure our community had the food and supplies it needed to stay home. It had the healthcare that we needed in order to recover from COVID. And then also due to years of structural racism, they're also more likely to be living in congregate settings, unable to follow some of our public health best practices of isolating at home, or be housing or food insecure, and have chronic medical conditions like obesity and high blood pressure that increase the complications of COVID. What's new? Reality is we're kind of living in a new normal now. We know that the virus is here in the community. We still have no proven treatments, still no vaccine that's available. And so really not much has changed since March when we first started really emphasizing the need to stay home, except that we have been able to build up our healthcare capacity. We've been able to get PPE supplies so that not just our healthcare providers are able to have the masks and everything, but our entire community is able to have that if they need it. So in the meantime, while we wait for those things to happen, we are working hard to be able to get people back to work and but also contain the spread of the virus. So nationally, I guess what's known as the box it in strategy, where we test people, identify those who have COVID quickly, and then we're able to isolate those people home in their houses or provide housing if they're not able to stay at home in a separate bedroom away from others. And then we're going to start contact tracing here soon, which helps us find people that were exposed to those that have COVID and encourage them to stay at home as well to what we call quarantine for 14 days to make sure that they don't develop symptoms. And the goal for this is that one day, hopefully we'll know everyone that has the potential of developing COVID and they are home and not in the community infecting others. We've expanded our team over the last 2 months and have 2 talented executives that are helping us with both our testing and contact tracing. So Bill Altman's come on, seasoned healthcare exec, who's helping us build out our testing strategy for the city, and Karen Handmaker, a population health expert, and who's leading our contact tracing strategy. We also, because public health tends to be funded crisis to crisis and not invested in holistically over the last 100 years, we are trying to ramp up our public health capacity right now. It's one of the things we need to do in order to be able to box in COVID. We awarded an RFP to Lacuna Health, which is a local company, to help us with the contact tracing piece of our box it in strategy. So they've already hired their first cohort, have been training all week, and we hope that they are going to be able to go live later this week or next week with starting that contact tracing piece of our box it in strategy. So when someone tests positive for COVID-19, it's reported to the health department, and then our team will call the person who tests positive to find out how they're doing, who they've been near, and where they might have been exposed to the virus. When they're going to call, it's going to show on the phone as Lou Health. Hoping that just encourages people to answer that. They're going to ask about your health and your housing, employment, to find out who you are in close contact to or may have been exposed to the virus. They'll ask you to stay home for at least 10 days, depending on how fast you're able to recover, and they can help you find what you need to stay home and stay safe and recover. They're also going to call you regularly to make sure that you're getting better, or if you have symptoms are getting worse, and how you can then seek medical care. Just want to make sure the message is out there that the health department does not ask for social security numbers or credit card numbers. They don't ask about immigration status or your health insurance. So don't expect to be, if anybody's asking for that, that is not the health department. We are trained to respect privacy and confidentiality. And we don't tell them your name when we're contacting others who may have been exposed to the virus. We just tell them that they have been exposed. All this information just really helps us stop the spread of the virus in the community, and it's what we're trying to ramp up so we can do in the future, so we can keep going on this path of reopening that we've been on over the last month, and hope to continue that. I think some other really important things to know, remember that, like, to know your risk. And so really, really important that we are wearing masks when we're outside and around others, especially when we're going into indoor places. The risk of COVID infection is greater inside. It's greater with the number of people that you are in contact with and the length of time that you're in contact with people. And then finally, your risk of exposure is also greater with, like, the more virus particles you're exposed to. And so the more someone is coughing and sneezing particularly, but also screaming loudly or singing, shouting, all those sorts of things, or like breathing in deeply and exhaling greatly when they're exercising, all increase the number of virus particles that can be spread. And so just encourage people to stay at home if possible. If you're outside, try to keep activities outdoors instead of inside, to make sure you're staying 6 feet away from others, and that you are wearing a face mask and washing your hands often. So I could talk for hours, but I just want to make sure that the others have time, and there's time for questions at the end. So I guess I'll either turn it over to Dr. Hester or back to the team.
Right. Yeah. Yes. Thanks. Thanks very much, Dr. Moyer. Greatly appreciate it. And yes, we'll go to Dr. Hester next. And a reminder, if you've got questions, feel free to add them and type them in the chat section here on Zoom or on Facebook Live. So yes, Dr. Hester, a little background first, has been division president and provider operations and system chief medical officer for Louisville's largest healthcare system since January of 2017, after serving as system senior vice president and chief medical officer going back to 2008. He joined Norton Healthcare in 2004 as chief medical information officer and served a variety of positions during his early days at Norton Healthcare. Dr. Hester is a lifelong Louisville resident and is a go-to source for local media and others who are looking for information related to local concerns about the pandemic. Prior to joining Norton Healthcare, Dr. Hester practiced emergency medicine full-time, serving as regional medical director for Kentuckiana Emergency Physicians. Dr. Hester holds a bachelor's and medical degrees from the University of Louisville and an MBA from Bellarmine University. He completed his residency training in internal medicine and pediatrics at the U of L School of Medicine. Dr. Hester, the floor is all yours.
Thanks so much, Dan. Thanks to Louisville Forum for the opportunity to discuss certainly this pandemic, and appreciate the opportunity to be here with the other panelists. I want to echo just a few points from Dr. Moyer. We are incredibly fortunate that during this challenge, we had great cooperation from both the state and local government. A lot of challenges and things that needed to be mobilized quickly, specifically how we were knocking down barriers. And I think it was a great example of how we work to, I think, protect Kentuckians and do the right things to help our community overall. When we look at 2020, it certainly brought a number of challenges. And I think if you're outside the medical community, you didn't really care about the jargon of flattening the curve, social distancing, or self-isolation or contact tracing. But it seems to be something that's in the news every day. And I think the real challenge for our leaders is, how do we protect the community while at the same time protecting individual rights? And that's a challenge. Because when you look around the globe, countries have done this differently in a lot of ways. And I think there's a lot to learn going forward and how we can make sure we take care of the population. And I think we've been fortunate to see that we've had a successful strategy in Kentucky. As Dr. Moyer mentioned, we've not overwhelmed the healthcare system. We didn't see situations like we're seeing, unfortunately, in Louisiana, New York, and in Washington State. But I think the real challenge going forward is how are we going to find our new normal? There's a lot unknown still, and I'm sure we'll get to some of that in the questions, but a real piece on how we figure out what that looks like going forward. And so early on, one of our big focuses is just how do we continue to serve the community and protect our employees and make sure we were ready. One of the things that really hit during this pandemic pretty quickly was just a clear recognition that the supply chain was disrupted. And it really showed how dependent we were on the rest of the world for, just things that we take for granted of masks, gowns, generic medications. And I think that really shows, and there's a lot to learn from that and how we prepare for future incidents to make sure we do the right things. And we had enough of that during this time, but it was because we had, again, a lot of partnership and a lot of folks working together to make that happen. One of the things too, I think sometimes it's not always obvious, but while COVID might be new to the community and it's a new virus, it's also new to our staff. One of the things we spend time a lot is preparing for emergent situations and planning for situations like this one, the pandemic. And when you look at something, there's a lot of difference between each of these viruses or bacteria even. And you look at Ebola as an example. Far different entity than COVID. And so how you prepare for that, how you manage that situation, a lot of things are similar and they're to be learned, but it creates different challenges. And one of the things too we wanted to focus on early on was how do we make sure we're taking care of our patients and our staff aren't worried about things. And we were fortunate to be in a position to be able to support our employees, maintain their salaries, and really avoid layoffs during this period. And I think it helped us make sure we had folks available because we saw people doing non-traditional roles, people stepping up to help in different areas of the hospitals, help in different areas of the health system to be available and support. And we're fortunate to have 16,000 people who stepped up in a tremendous way to help, I think, the community sort of get through this. During this pandemic, we've tested almost 30,000 patients in all areas of the community. We've been really fortunate to partner with a lot of community organizations to help us take testing into the community that may have had limited access. Early on too, one of the things I think that everybody was seeing on the news daily was there just wasn't enough testing. Testing wasn't available. It's not easy to get access to. And I would say, it's one of those things where it does show in terms of modern medicine where we sit today, because we're so blessed to be able to go get testing for diseases, to get diagnostic studies. But really, when you think about it, the first case now it looks like may have been around in November of 2019 in China. And to think, while it wasn't fast enough to help us manage the pandemic in some ways, it's incredible to think how quickly we did have testing available. When you look at that in a way, again, we'd love to have had it sooner. But you saw, scientists out there creating and folks innovating in ways to get that available in the medical community. And I think one of the things too that's important when you think about testing is just to highlight, really two primary ways of testing right now. One's what's the traditional PCR testing, which looks for a piece of the virus and they stick a swab in your nose, and it's a bit uncomfortable to get done. But that really looks to see, do you have the virus now? And then there's serology testing, which is sort of that next step of testing. That's sort of that look back, looking to see if you've had testing. And, the challenge is we're still learning. While it's nice to know information, it's sometimes we're not sure if the antibodies that people have can effectively neutralize them and keep them from getting another infection. So there's a lot still that we're learning. When we've done testing in the community lately, we're testing anyone who has a procedure at our facility. In the past couple of weeks, we've tested nearly 5,000 patients. Out of that 5,000, we found 14. And so when you think about that from an incidence standpoint of asymptomatic patients, it's about less than 0.3%. I think that's a good message for our community in the sense that we're seeing that, but I think it still does exist in the community, and we need to make sure we're doing those things: social distancing, hand washing, wearing masks where appropriate to prevent the spread, and we certainly don't want that to grow. I do think one of the other things just to hit for briefly is I think we've seen tremendous innovation too in a number of areas. And I think it's not just, healthcare industries, but it's all industries. For a moment, just to highlight one of the local businesses. I know a restaurant we went to, Texas Roadhouse, early on jumped on the ability to say, how do they get online? How do they do drive up delivery? How do they do that in an efficient way? And you saw a number of businesses continue to find innovative ways to do things. And I think that's been some things that we'll continue to see as we move forward. We've done more drive-through testing during this than we have for any other time. So much so that we're going to do a permanent drive-through location. It's going to complement our telehealth platform, where if someone has a telehealth visit and needs to get some diagnostic studies, they're going to be able to do it. So I think those types of innovations are really exciting. I think certainly this pandemic will change us. While we feel we've kind of gotten past the immediate challenge, we're in this learning period. And so how we adapt to that change is going to determine, our success or failure. And I think together as a community, we've seen a lot of growth around the pandemic and a lot of partnership that's happened there. And I think for the better of the community, and certainly I think when we look around our surrounding states, we sit in a pretty good situation in terms of the care that's been provided for our patients. So again, look forward to your questions and appreciate the opportunity to be here.
Thank you, Dr. Hester. And that takes us to Amy Hess, who we'll hear from. And again, feel free to submit your questions as we listen to Amy's comments. A little bit about Amy. Until recently, Amy Hess served as Executive Assistant Director of the FBI's Criminal Cyber Response and Services Branch, and she was the highest ranking woman in the FBI. Then in November, Mayor Fisher announced she would become Metro Louisville's new Chief of Public Services, where she would oversee such critical departments as Public Works, Emergency Services, and Corrections. At the time of that November announcement, Amy probably had no idea that a pandemic was going to be the bulk of her time when she began her job on February 1st. Since taking her new job, Amy's role has been essentially to lead Metro Louisville's crisis management team in addressing the pandemic. A native of Jeffersonville, she previously served as the FBI's special agent in charge of the Louisville field office, where she had responsibility for all FBI personnel and operations throughout the Commonwealth. In that role, she led the FBI's participation in strategies to reduce violent crime and to combat the opioid epidemic, among other things. Amy holds a aeronautical and astronautical engineering degree from Purdue University. And Amy, welcome to the forum, and the floor is all yours.
Thank you. And it's great to be with everybody here today, and especially my fellow panelists. Obviously, Dr. Moyer and I spent a lot of time together in the Emergency Operations Center, and of course, Mr. Hester as well. We had a lot of interactions on these topics. So I wanted to spend just a few minutes, though, talking about what we referred to as incident command and how that related to this particular crisis. So in my prior job in the FBI, we obviously responded to a lot of different crises events over time. And I remember at one point in this job, the mayor came to me and said, well, but you're used to crises and crisis response. I said, yeah, but the difference here is that I was used to responding to things like, for example, the FBI's response to mass shootings or to terrorist events, bombings, or even chemical attacks. But this was something that I think no one had experienced in, at least in our history and our generations, to realize how many elements have to come together to respond to a crisis like this. And so early on, if you recall, I believe it was on March 3rd, the governor declared a state of emergency. And between that date and March 13th, when Mayor Fisher declared a state of emergency for the city, for metro area, a lot of things happened. We had a lot of conversations about how we would treat this from what we call an incident command, an incident management type of structure. Because it was different. Not only was it different in the sense of what type of crisis we were dealing with, but it was also different in how we went about staffing it. In most emergencies and most crises events, you would typically gather people together in an emergency operations center, in a command post, if you will, and people would be sitting shoulder to shoulder. And there were real concerns about that. And we clearly had a lot of lessons to learn. Also, with respect to how Louisville Metro government continued to provide necessary services, everything from trash pickup to paving of roads to things that people expected to continue during this crisis. How should we go about doing that and try to do it safely? So we had a lot of discussion early on. And it was, I believe, on March 9th, when we called all of the Louisville Metro directors together from all the different departments to have an internal meeting. Well, clearly things were happening really fast by then. And that week of March 9th, we had lined up a series of meetings, first with our directors, and the next day on March 10th was for our external partners. By then we were questioning whether or not we should even bring in our external partners, because we were trying to promote social distancing and starting to get used to this whole idea of attending meetings virtually and online. And then we wanted to set up a tabletop exercise for that week. And in most crisis events, really before things get really spun up, you have an opportunity to plan a tabletop exercise so you can think through how you would respond to a crisis. But things were happening so fast that by the time we actually got to Thursday, which was the date of the tabletop exercise, where we had our internal departments as well as our external partners that we had brought together earlier in the week, the scenario we had planned was already outdated. For example, in the scenario, we were planning for thunder over Louisville, and we were planning on anticipating that we might have one traveler who would come into the Louisville airport, and how would we react to that? And simultaneously, we might have 2 individuals who were at a senior living facility. And how are we going to react to that? Well, things were happening so fast that those things were quickly transpiring and out of date by the time we got there. So by that Friday, we established our incident management team, where we activated our command post, our emergency operations center. And actually today is, I believe, operational day number 90 for that particular command post. As part of that command post, we had about 75 Metro government employees who were assigned to it full time. but about half of those were actually teleworking. They were doing it from a distance. And again, that presented its own challenges. But we split people into different teams. And the way the incident command structure works typically is you have a command structure. You have a unified command, but then you also have elements underneath it. One that's handling planning, looking ahead to see what do we need to plan for? How do we go about doing this thing? And they developed a variety of plans, working particularly with Dr. Moyer's folks and others to identify, for example, how would we deliver food to seniors and continue to practice good social distancing. And if those people were isolated at home, if they were stuck at home, how do we get that food to them? Also, essential services, things like transportation. How should we think about public transportation? And then our first responders. Particularly, I was interested in this category because the first responders would fall under me as public safety. And so between emergency management, emergency services, and fire, and the police department, which I actually did not have responsibility for until 2 weeks ago, that was another concern though. How do we get these folks tested? And the jail was a particular concern. So the Department of Corrections, we were seeing what was happening across the country and really thinking through how are we going to respond to that. So as we went through this process of the planning and how we would implement these plans and thinking about the logistics and the things that Dr. Hester had mentioned as far as the personal protective equipment, how are we going to get that stuff? How are we going to get it to our first responders? What we saw is over our first responder agencies, our public safety agencies, really tracking how they were being exposed and what we could do to help prevent their exposure. And I'm happy to go into more detail with any questions you might have, but it was interesting that things you might expect to see, like for example, we had an increase in the number of ambulance runs we made for breathing issues, but we also had an significant increase in the number of ambulance runs we made for burns and poisoning. Probably because people were spending a lot of time at home and getting into things they probably shouldn't be getting into. With LMPD, we had an increase in the number of shootings and stabbings. And so that was unusual compared to other cities. And then in corrections, of course, as I said, that was its own special problem because we had to figure out a way to get as many people tested as possible. And to date, I'm happy to say that we've actually tested about 85% of our inmate population. So over 1,000 inmates have been tested to date, and we've only had 10 test positive so far. But we recognize that's just a point in time, and we need to continue that cycle. And with that, I'll stop there so that we can turn it over for some questions.
Thanks very much to all three panelists. And we do have questions. And again, you can submit them in writing in the chat section here on Zoom or by way of Facebook. And I'm going to turn over to Joe. We're going to do a little tag team here, but Joe's going to sort of lead the charge. Joe.
I'm going to try to direct these questions to an individual panelist. If the other ones want to also respond, that's fine. But we have a lot of questions. We have about 23 minutes left here, so I'm going to try to squeeze in as many as we can. So the first one is going to be for Sarah Moyer. What is your response to those who do not want to cooperate with contact tracing, and have you had any such cases yet?
Well, I mean, the pandemic really illustrates how we're all connected, and so I have the belief that everyone wants to be healthy and they want our community to be healthy, and so just trying to encourage them that way, and then also just reassure that we have the ability to connect them to essential needs. So if it's because they don't have a place to isolate or they're worried about their job or their food, that we can help them with that if that's an issue. And contact tracing is not new to the health department. It's new to COVID because COVID's new, but it's something that we do all the time. So it's the same process we use for tuberculosis, for our HIV cases. It's the same thing that we're trying to work with Ocean for our Cure Violence program. So contact tracing is well known to the public health world, so lots of tools in our bag to try to make sure that everyone participates. And I guess the other big thing to add to that is we protect your privacy of your information. We only share information with the public or your employer if it's needed in order to protect health. We don't need to say your name. And so just making sure that people understand that point as well too.
For Dr. Hester, since the original goal of flattening the curve was to make sure the hospital system was not overwhelmed, does Kentucky now have enough PPE and ventilators to allow the state to resume normal life?
I would say, again, the normal being how we defined, what we can do and try to prevent any further, spike. I would say that certainly I feel comfortable with what we have. And to be honest, I felt comfortable with what we had throughout the pandemic, the way it was managed in terms of the way that, we did flatten the curve. So from that standpoint, we never reached a critical period where we felt like we were at a shortage. And I think, again, I would say that all the health systems in Louisville have now taken the opportunity to gather more PPE to make sure that there's a large stockpile of that in the event that things come forward. And so I do think that from a health system standpoint, as long as we continue to follow some structure in that, I think we're in a good place.
We do have a follow-up question on Amy Hess. You mentioned some of the police calls, and I'm going to combine two questions here about community health damaged outside of COVID-19 with increased domestic violence, addiction, suicide calls. The questioner says, while calls on child abuse are down, many speculate that these numbers are also increasing. Can you share any observations? And also there's a question about, this might be for both you as well as for Dr. Moyer, any uptick in the needle exchange program? I think you're on mute, Dr. Amy Hess.
Sorry about that. I'll start. With respect to the police runs, so interestingly, we were about 12% down from last year during the same time frame between March 1st and the end of May. Part of that was because, of course, really trying to limit contact with people, didn't have people out on the streets, so we were way down on the number of handling traffic or hit and runs. Things like that, evictions, because of course the eviction orders were not being enforced at the time. And so what we saw was a very different type of policing. But what concerned us was that certain things may be going unreported. And so when we saw other things that, for example, that we saw that should have been reported, for example, trouble or domestic trouble, things like that, we were still getting those calls, but not quite to the extent we had in the past. Clearly of concern. Another thing that concerned me, frankly, was that for our ambulance runs, we had about an 11% increase in this time compared to last year in the number of refusals, the number of people who refused to go to the hospital. In other words, they summoned the ambulance, but then they didn't want to go to the hospital because they were scared. They were scared to go to the hospital. And so clearly that's of concern to us very much. And I'll let Dr. Moyer talk about the needle exchange.
Yeah, so I think, just to add to that, we did have an increase, I think, in overdoses in March when it first started, but since then it's been about even or down compared to previous years. So I don't know if claims that calls like that and suicides being up are actually true. As you guys remember back to pre-COVID, deaths of despair was the public health crisis that we were focusing all of our attention on. And so overdoses, suicides, homicides have been up over the last 10 years in general. So something we are definitely focusing on and spending a lot of attention on. So syringe exchange program, another program in the city service that had to adapt to the new normal. And so adjusted our services to decrease contact with participants, but still getting the necessary naloxone and supplies out to them. And so numbers have been about even since pre-COVID, and just thankful to be able to have that service in the community to continue to be able to save lives.
A couple of questions I'm getting on my end here. One having to do with the protests and public demonstrations that have been going on for the last week and a half or so. Obviously, lots of large groups of people close together. Do you have concerns, and talk about them if you do, on a possible outbreak or a surge as a result of the protests? And that's for anybody on this panel.
Yeah,
I can go first. Or go ahead, Dr. Hester.
I was just saying, certainly I think that early in the community, when we saw a higher incidence, it certainly having folks to gather in that situation would have been a lot more challenging. It still presents certainly a risk. Anytime we have folks that are together like that, and large gatherings, especially as we're trying to come out of the backside of this, it presents some challenges. I know that we had partnered with Metro government this past weekend to do some testing on protesters, and had done a large number of testings there. And so I think it's a matter of just continuing to watch and make sure that, I think the thing that we want to continue to emphasize to folks are, if you do develop symptoms, you need to get tested so that we can then figure out what the appropriate isolation is. At the same time, this is not new with the pandemic, but washing hands saves lives. And so, if people wash their hands frequently and make sure we're not transmitting things, it's incredibly important. So I think we follow some of those same behaviors are going to help us through this challenging time.
We have a couple questions related to the hospital beds that were set up at the fairgrounds. A couple questions on that. One questioner says that a similar setup in Lexington may have been privately funded. So part of the question is this: who set up the unused hospital at the fairgrounds with 2,000 bed capacity? And they're asking about the cost to taxpayers, and is it still necessary, considering that we, according to the questioner, have an abundance of empty traditional hospital beds around the area?
So that was set up by the state health department. No local public health tax dollars went to that endeavor. And I think, can't speak to future need, but I think we have got a much better grasp on testing and identifying people early, and just able to make sure our local hospital systems have capacity going forward. Hopefully we don't have the need, but I mean, we estimate that, I think only 2 to 5%, if not less, of Louisvillians have had COVID. And so we've got the potential for this to change overnight if people change their actions. So we could be right back where we were in March if we're not careful.
One last question I have here, and I'll turn it back over to Joe. Questions here having to do with school and other events in the fall. Let's talk specifically about school. Would any of you care to project on what going back to school may look like this fall?
I see everyone looking at me. So I think the state health department's coming out with some guidelines here any day now. So don't want to get ahead of them, but I mean, it's going to look different. I mean, all those really important things about spacing and hand washing and screening for symptoms are going to be a part of whatever happens. And then just monitoring. I mean, it's still new. We don't know what long-term sequelae are from COVID, or even more details on the pediatric inflammatory syndrome. So I think every day we learn more, and that it just leads to the guidance of what's going to happen in August.
Dr. Moyer, I know you don't want to get ahead of the state, but as a former reporter, I'll press you a little bit and ask you, if you had to make a prediction for people planning right now, do you think school year will start on time?
I think school year will start on time. I don't want to say what that will look like, but I think school will start. I mean, I know some universities are even looking at starting early so they could be done by Thanksgiving and not have to have those contacts back home and back. So I think at least it will start on time, but we'll see what it looks like.
And speaking of school, the other question related to that is, what process should be followed? What factors should be considered before a decision is made as to whether athletic events should be held on the high school and the college level? So Dr. Moyer, I'll start with you, but I'd be curious on other panelists as well.
Yeah, so same thing. I mean, so sports games, it depends on the sport and how high touch, how close you are to each other, and then the fans as well too. So having fans packed in closely, screaming, all that is potential for spread of COVID. And same thing, indoors versus outdoors. I think there's ways to do it safely, ways to do it well, but it just all depends on your personal level of risk taking and what you want to do, and same with the school. So I'll let Dr. Hester add.
Yeah, the only things I would say there, I think, and I agree with Dr. Moyer. I think, one of the things we've traditionally done is kind of gotten ourselves into a calendar of when sports happen. And I think we're even seeing a little bit of that with, the NBA sort of saying, hey, we're going to have playoffs start, late July and go later. And I think that's an opportunity probably at some level, and I'm sure they are at other sports groups looking to see when's the best time to have those events. Because especially in your individual sports, there's a lot less risk than there are for those large contact sports.
Amy, do you want to add anything to any of the things we just asked about?
No, the only thing I'd say is that certainly from a public safety aspect, any place where we're bringing people together, and we talked about a little bit the protests earlier, clearly that's of major concern. We had police going through the crowd, handing out masks, but whether or not anybody was wearing them or wanted to wear them, we did see a number of people who actually were taking precautions. But then my concern was not only for the protesters, but also for the officers, and then particularly the individuals who were arrested and having to go into our jail facility. That presents yet another problem, because you cannot exercise social distancing inside a jail. And so taking all the precautions we could, doing screening as we've been doing all along at the jail, trying to, of course, provide masks to the inmates there. All of the staff members are required to wear masks. And the jail actually has one of the highest percentages, or the highest percentage, of all Louisville Metro departments for testing of its own staff, as well as I already mentioned the inmates. But despite all that, one of my biggest concerns was just the volume of people that we saw over this past 2 weeks. And I'd have the same concerns where you're bringing anybody together in that type of setting.
Well, that's a perfect follow-up to one of our questioners on our Zoom chat here. And it's a follow-up to what Dan asked before about mass protests. What is the risk difference between participating in mass protests and attending church, going to a restaurant, patronizing a business? What's the difference in the risk?
I'll let Dr. Moyer continue.
Just knowing your risk. So outside is less risky than inside. So I would say if you're going to church or someplace that's having services inside, that's more risky than a protest. Being able to space 6 feet apart and wear a mask, whether or not people are using a microphone or if they're singing in group and then having to take deep breaths, all that increases your risk. So it just depends on the circumstances. I think there's ways to do a lot of activities safely. And then what Dr. Hester mentioned, washing hands saves a lot of lives. A lot of tools that we've had for a lot of years are really coming into play, and remembering the importance of them. So hand washing, really important.
Dan?
Yes, a question for Dr. Hester. Could you talk a little bit about when things were at its peak in terms of your patients, a little bit about the strain that did cause at your hospital, and how prepared are you moving forward?
One of the things, early on, as part of just trying to do the right thing to flatten the curve, everyone had jumped on the fact that we would stop elective procedures. And we really defined that at the time as looking to say anything that could wait 30 days to be done. What that did was really make sure that there's capacity within the healthcare system to take care of the acutely ill patients. It made sure that ICU capacity was available. So during that peak, we felt like we had adequate capacity. And it put a strain in the sense that these patients, in terms of making sure that you're doing the proper things from a isolation standpoint, from a staff standpoint, and looking to see, the innovative ways to make sure you're providing care while at the same time protecting everyone else. And so, it does create a challenge for healthcare systems when you're taking care of patients in large numbers. But I do feel like just the stopping of the procedures that were elective allowed us to have the capacity to adequately take care of patients during that time.
I could follow up, Dan, with a medical question for the panel. Do you think we can tamp down a flare-up or a second wave quickly because of the experience of getting through this first wave? And a second question, the same questioner has, do we know if some who have recovered we'll have any long-term or future issues caused by the virus. So again, we'll be better prepared for the second wave because of the first, and secondly, long-term consequences. Maybe we'll start with Dr. Hester, since you were just talking.
Yeah, I do think we are better prepared. I think we're better prepared because we know a lot more about the virus today than we did, 3 or 4 months ago. And we continue to learn more every day. And so I think that's going to be a big factor for us on a go-forward basis. I think just our ability to adequately test patients in a broader scale now allows us to do things where we can see that there are flare-ups. I know that I'm watching our numbers daily that we're testing, and we're probably testing 500 or more patients every day. With our spread in the community, it allows me to have a good feel for what's happening to see. And so that's where, with Dr. Moyer and myself, we're communicating regularly amongst our groups to say that if we're seeing flare-ups of information or patients, we're looking at those. So that puts us much better for the future. I think to the question about the things about long-term, really we really haven't been long-term, so it's hard to know what that's going to be. I think one of the things we have seen, which is interesting, is that patients, a number of patients with this virus will lose a sense of smell and taste. And there have been some, national reports of patients who continue to have that for a long period of time. Now, again, those have been very few, but that seems to have been one of the sequelae of the virus that does continue for some folks. But I think there's still, again, while we know a lot, there's still a lot to learn for the future.
Any thoughts from Amy Hester, Sarah Moyer on that last question, or should we move on to the next one? I will move on. I think I read your lips there. If I could, let's talk about public trust before we go to the last question from Dan Hartledge. How have governments and health advocate authorities gained community trust in prior pandemics? How will Louisville authorities recover trust in time for the second wave? Maybe we'll start with Sarah Moyer for that one, and we'll move to the panel through the other direction.
Yeah, so one is just the last big pandemic was the flu of 1918. So not something that I've dealt with in my career, and most public health officials or anybody really has. But it's something we've been working on for years. We've established our Center for Health Equity in 2006 and have expanded and grown that, and try to take community feedback into everything that we do with the health department, working with the Office of Globalization, just trying to make sure that our communities that maybe don't get news media the same way you and I do are able to understand and know what to do. And then just based on other smaller epidemics, whether it was the Hep A epidemic that the CDC declared that Louisville's response was like the gold standard in the country, just building on things like that we've learned continues to be a work in progress, but hopefully community understands the importance of public health and participating in our interviews when we call you, the importance of getting tested as fast as you can, as soon as you can when you start to have symptoms, the importance of staying home when you have symptoms so you're not out in the community infecting others, because you might recover fine, but there are others in our community that might not have the same response. So hopefully people are understanding that message, and we work every day to continue to try to get that out.
Let me
I could ask other panelists, Dan, and then I know we have to wrap up though, but Amy Hess and Stephen Hester on that last question about, do you think we need to restore public trust at all?
Just on the topic of, restoring public trust, personally, I think we learned a ton from this, and while there's a lot going on under the surface of the water that people didn't see, I hope it does give reassurance that we all learn from this, and we learn how to deal with crisis events. We learned how new types of communication. As Dr. Hester said, I think there's a lot of good, really creative ideas that came out of this experience as to how we change the way we do business across the board. But communication is clearly key. And that's something that I think we'll all take forward with us, and I'll leave it at that.
I'll jump in just real quick and agree with the other panelists. But the other thing I would say is I think early on we started, I think transparency is incredibly important through this process, or any situation like this, continued communication. And with our employees, one of the things we really started early on was just on a daily basis, sharing numbers, sharing the number of patients we were treating, the number of employees who were positive, those types of things. And I think, again, the state and local governments have done a lot for that. But I think that as we go forward, that's going to be important. While it doesn't seem as exciting when you're not watching it day to day, when flare-ups happen, I think it's going to be important for us to be transparent and share that information.
If I may, I'd like to close with one final question that is a public health question. It's also a little bit of a self-serving question, in that it has to do with the Louisville Forum. We meet once a month, second Wednesday of every month. 80 to 100 people get together in a dining area at Vincenzo's, round tables of 8. Your speculation, your thoughts on when that type of meeting might be able to occur again, where people can be comfortable and reasonably safe, and talk to us a little bit about that. And I target that's open to anybody and everybody on the panel.
People are looking at me again. I mean, I think the governor has come out with groups of 50 starting in July. So, legally, it'll be safe coming up here soon. Whether or not you want to do that, I think this forum worked out great over the internet. And so would encourage anytime that you can do it remotely, that we continue to do that. It's hard to eat with a mask on, especially inside. So I think as long as this is working, we would recommend continuing it.
Yeah, I think when you look to the fall, especially, one of the challenges we have is, while things are going down, feel to be going down now, we don't know what's going to happen in the fall with this virus, especially with weather changes and things like that. And so as we learn that, it's going to be things, and that's where I think we're going to find that we need to be able to facilitate change and adapt, and again, continue to innovate and find ways to do things differently.
Okay, anything, Amy? Any last words?
I just appreciate the opportunity to be here, just to talk about these things, and thank you very much for giving us this forum.
Well, thank you. And Dr. Hester and Dr. Moyer, thank you as well. On behalf of the entire Louisville Forum and the entire city of Louisville, we appreciate you being here. And we also want to thank you for your roles in helping guide the city through one of the worst health crises ever. We appreciate that. And we hope that all of you guys will consider sometime down the road, when your schedule allows, to pay another visit to the Louisville Forum. We would love to have you as guests. Our next meeting will be held on Wednesday, July the 8th. We have not pinpointed a precise topic just yet, but we certainly plan on a topic that will be very relevant and important to the community. It remains to be seen, although I think our experts have kind of painted the picture for us. It most likely will be virtual come July. So an email will go out to all members as soon as that's firmed up, and as soon as we have a topic firmed up. And you can also get that information from our website at louisvilleforum.org. And finally, I want to thank Ashley Bauer, who worked behind the scenes in terms of setting up the technology for today's lunch. With that, we conclude our June program. I thank everyone for your participation today, and stay safe and stay healthy. Thank you.